Hello, doctors. We welcome you today to this webinar with Dr. David Smaldone. This is Clark Tilley with Thrive. We want to excuse Dr. John Brimhall. He texted me late last night and said he had some critical patients that had to come in that he needed to work on during this webinar time. So he sends his apologies to all, but is very confident and thrilled that Dr. David Smaldone can be with us. Dr. Smaldone will be presenting his specialty here that he's going to share a little bit with you at Homecoming, coming up the end of January. So again, invite you all to Homecoming. And with that also, if you have questions as we go along here, if you'll type those into the area where you can ask questions, at the end of the presentation, we'll be able to answer some of those questions if you have any. So with that, we'll turn the time over to Dr. Smaldone.
All right, thanks for having me, Clark. I appreciate the opportunity here to speak to you guys today. And I don't know if any of you guys out there have actually tried the Thrive system that Clark has developed here, but I really appreciate the opportunity to present, and the system you've built is just amazing. It's the infrastructure that you built behind it. Some people say, you can't build that kind of infrastructure, and you've invested in it, and I've seen huge results in my clinic. So I really wanted to thank you, first of all, for that, Clark.
Thank you.
And so today I'm going to be presenting about kinesiology tape and how it functions, and just kind of give you guys a little bit of idea of my background. I was an athletic trainer before I was a chiropractor, so I've done thousands of hours of taping with athletes, amateur, professional athletes. I have over 60 articles published online between 2009 and 2012. And I've been working with athletes now for over 10 years in the practice, and I really just want to show you guys some amazing things with kinesiology tape and how to really help your practice thrive, because it's an amazing tool that you can use, and you can also use it as a generator in your practice. Let me start here. So I wanted to go over some basics of kinesiology tape, benefits of it. I truly see in my patients that when I start adjusting them, some people hold great and they can just kind of go on and they do with one adjustment. But I find that people who are having problems getting the adjustment to hold for longer, that the kinesiology tape just makes such a huge difference in their life. And, I see things online like some people say the kinesiology tape works great. Other people say it doesn't work great. And the analogy I'll put out there to you is that if you give a toddler a hammer, they can't get a nail into a board. But if you give a professional, a carpenter, a hammer, he can build you a house, right? So that's kind of the deal with the kinesiology tape. I see patients trying to do it themselves, and it never works out so great for them. So you really are an instrumental tool in being able to kinesiotape people. I have people who come from all over the place just to get kinesiology taped in my office, never mind adjusted. I do tend to throw that in there with it because it works great in collaboration. But you'll see patients just coming into your practice who just want to get taped. It increases proprioceptive awareness, so it increases your awareness in space. It supports the ligaments and the muscles, and you can do this by taping in different directions, along the muscle, across the ligaments, and also increases lymphatic drainage. So when you hear increased lymphatic drainage, you think, like lymphatic drainage, so people with like lymphoma, but it actually, you'll see people who are bruising, when you tape over it, it will actually decrease faster in the areas that you tape over than the areas you don't. And what are we doing this for, right? We all want to help people, of course, but we also want to make a little bit of profit. So here's a great example of how this kind of works in your office. If you simply tape 10 people a day and you charge $10 a tape job, over 200 days open a year, you're increasing your revenue by $20,000 every year. And the nice thing about this is each tape job takes me about a minute, maybe a minute and a half to get the tape jobs done. So at the end of the day, I see big increases. And not only that, but when those people are out in public, I do this, I actually order like the craziest tapes possible. And why do I do that, right? I do that because when those people are out in public, you actually will see other people asking them, oh, where'd you get that? What's wrong with you? How are you? And if you've done a great job taping it and it looks nice and professional, you can get referrals from that like crazy. I mean, I'd say I probably see 10 new patients a month just from referrals from Kinesiotape. So here's different types of tape: rock tape, spider tape. I do not recommend KT tape. I think the adhesive is just absolutely the worst out there. Strength tape, Aries tape, there's all sorts of tapes. The ones I really stick with are rock tape, spider tape, strength tape. Those are the big ones that the adhesion lasts the longest. Strength tape is definitely my favorite out of all of them. Life expectancy for Kinesiotape is usually about 1 week. I've seen this tape last up to 3 weeks, but average is about 1.5 weeks, 2 weeks. And also they have minerals in it, so copper, magnesium, iron, calcium, which help with decreasing inflammation. So I really like strength tape, and I recommend it to everyone out there. So a lot of people don't clean the skin, and I like to clean the skin because I notice that A, it lasts longer, and B, you have less allergic reactions. And I don't know why that is, whether dirt gets trapped underneath the tape or how it works, but just make sure that afterwards they're not sweating or doing anything crazy for the next hour or so, and that adhesive will really get in there. If the tape gets itchy, make sure that they can rub aloe vera lotion in right through the tape. If it gets super itchy, though, 1 in 100 people will have an allergic reaction. So make sure that you definitely tell them to take it off if it gets crazy. So here's a nice piece of tape, and what I talk about when you're taping people, you want to have it nice and presentable. So you want to have the corners nice and rounded up at the top there, you see, no wrinkles in the tape, because when you're out in public, this is a representation of you and your practice. Don't be afraid to take it off and start all over again. That happens, and people are patient. I noticed that if you're doing an ankle tape, make sure that you put a Ziploc bag around it when they're showering, because it can get real nasty. And you want to make it about 1 inch longer. That way they can trim it away as it goes, and it will actually last longer for the patient. And since they're paying for it, it's nice to be able to make it last longer for them. So here's something, and look at this picture for a second. At first, this is a picture that they used, and they sent it out on my email, Clark. So it's kind of a joke that I'm posting this, but it's a horrible representation of Kinesiotape, and I'll tell you why. There's a couple things here, and this is part of the pitfalls in chiropractic. And you see that KT tape here is on the line for this one. So first of all, when you're taping someone, you want to make sure that it follows the anatomy, right? So we all know that the hamstrings cross where? They cross the knee joint, correct? Well, look at the tape here. It's above the knee, right? And secondly, he's taping onto her shorts. How long do you think that tape is going to last there, right? So when you're taping, make sure that you're following the anatomy and that you put a little extra on. You want to go past where the muscle inserts and the origin is. That way you get full support along the whole muscle. And for God's sakes, put the same color tape on someone. Don't use different color tapes. Now, I use different color tapes here, for example, so you can see the difference of different pieces that I'm putting on as I go. So a lumbar taping, the patient is lying on his side, however, best results from forward flexion. And I noticed that this is one of the best tape jobs. So you're just simply going to cut two different strips, 8 to 10 inch strips. And, oh, where'd it go? Oh, sorry, the slides got slipped here. All right, so we're going to go over that. We're going to go back to the lumbar. That's in the next section. Sorry, we're going to go over the ankle tape job here. So in supporting the ankle, this is one of the ones that are going to bring all the athletes into your practice. So first of all, you're going to do a strip on the outside. You're going to pull from medial to lateral all the way to the outside, and you want to make it nice and taut so that the foot is up at a 90-degree angle. And next, you're going to lock down the strip. So you're going to do one cross across this way. Now, Clark, can they see my arrow on the screen? Okay. So anyways, you're going to...
I was muted out there, but yeah, okay. I can see your arrow going back and forth, so yeah, our audience should be able to see that as well.
Okay, great. So you're going to lock it down here. And now a lot of people won't lock down in between strips. So you put one strip down from medial to lateral underneath the foot and then lock it down. The next you're going to do another one from medial to lateral, and then you're going to lock it down. And the reason why you do that is you not only want to provide vertical support, you also want to provide horizontal support. So that way when the foot, if it gets all sweaty or wet, it really sticks on there. It doesn't slide down on the patient. Now, this one is, we have a lockdown here, and then we have another strip here coming around. So we got two strips on it, and then here you can see the third strip going around the back. So you got one in the middle here, one in the front here, and one in the back here. Now, after you do those and you lock them down, you want to make sure to do a figure 8. And what does a figure 8 do? So this is a figure 8. It goes around the top here, and it comes down around the foot, over, and then back around the back here and around the front. Now, a figure 8 will keep the foot in dorsiflexion. It helps that mortar, it helps that sit nice and stiff in there, so when they're walking, they actually are kind of cocked up in dorsiflexion. And then here you want to do an ankle lock. So you're going to come down around the back on the out. You're going to start here. You're going to come around up here. You're going to come down around the back, and then on the inside you're going to come up and back around. So that's called an ankle lock, and what you're doing is you're actually locking the calcaneus in place for this person, and it makes a world of difference. I've seen people keep this tape job on for 3 weeks sometimes, and the Kinesio tape just does so much of a better job giving dynamic support as opposed to the white tape. Let's see, and here's a nicer view of it. So, you know, the ankle lockdown's here, coming across the side, and the figure 8's coming across here, and then we'll just simply lock it up on here. Now, if you have any questions, make sure you type it in on the side there, and Clark will answer your questions at the end. So the tape should feel firm, supportive, and you know, always check the blood supply on any tape job from the end of the distal to the extremity. And one of the cool things is this will build your practice. Now, this next tape job is a rib tape job, and literally I've had 2 whole, one MMA gym and 1 boxing gym, and they send all their athletes to me because I'm the only one, it seems, in the area that does rib taping. It's a super simple tape job, and it's great for costochondritis. It's good for intercostal strains. It's good for fractures that they can't get any support from because, you know, what do they do when they go to the MD and they have a fracture? They're still like, oh, well, suck it up. Take some pain meds. And not everyone wants to take pain meds. So simply, here's our ribs here. And what we're going to do is we're going to put 2 strips down. I'm going to show you 2 different tape jobs today. And this one is simply you're going to put 2 anchor strips down on both sides of the ribs. And so for this one, the pain area would be right in the center here. So we're going to get support above it and below it. And what we're going to do simply is we're going to pull from lateral to medial, and then we're going to pull from medial to lateral, kind of sucking the ribs together. And now the basket weave pattern here, here, and across here, this one's a little bit off, but you want to make sure that it's right along the center here. And the reason for that is that it provides that support in the maximum area of pain. So, and then you're just going to simply close it down with 2 anchor strips here. And it looks nice and neat here, goes right up the center, and patients will immediately tell you that they feel better. It's really a cool tape job. Now, this is the star tape job. And what I did this here is I used just some spare scraps on the tape job so I can give you a good idea of what it is. Obviously, hopefully yours is a little bit cleaner, but so you're just going to put 1 strip here from medial to lateral, and then you're going to start to go from diagonal to diagonal, and then bottom to top, and you're going to pull everything together. So in this tape job, the pain will be right in the center of all the pieces of tape. And what it does is it sucks the skin together, and it pulls the ribs together so that it decreases pain. Let's see here. So here's a nice picture of it. What we did here is that first strip, and then diagonal, diagonal, and then up to down on here. So this is the lumbar taping, and one of the things I really love about this tape job is that it's so simple, works so great, and you get immediate benefits of it. Now, you can see it's a nice bright color, right? And I love doing this, and people will send their family members in. Everyone asks, or they take classes at the gym, and everyone's asking a class at the gym. It's nice, vibrant, and it tends to bring lots of people in. And I just tell my patients they got racing stripes on, and they laugh, and then that's it, you know. I wanted to talk about the lumbar brace here. Now, I see this all the time, and what is this for? You know, like, it makes no sense to me. You have a cross piece of tape coming across here. I don't know what it's for. There's no ligaments that go across there. There's no muscles that go across there. It's supposed to be supporting something, but after 10 years, I'm still trying to figure out what the heck this does. So crossbars, I will yell at you if I see you taping with crossbars. I will come through the computer and yell at you. No crossbars. And also, you want to make sure how much tape are you using, right? So I have some professional power lifters who come into my office, and these guys are like 350 pounds, right? So do I think that one piece of tape is going to support this guy who's 350 pounds of pure muscle? He's deadlifting 550 pounds? No, you got to make sure that each patient has the right amount of tape. So yeah, it might be good for a 90-pound girl, but if you got a guy who's, you know, he's jacked up and he's diesel, you got to put on extra tape to make sure it's supported. So obviously, look at the patient, look at the anatomy, make sure that it's covering the whole span of anatomy and that you have enough tape on. Now, what can we do about people who have allergies? Because there are a decent amount of people who have skin allergies, latex allergies. There is hypoallergenic tape out there for those people. If they need a long-term solution, what I'll recommend are these Intelliskin shirts. They're wonderful. They're lightweight, they're breathable, they're washable, and they're totally affordable for the patients. And you can also make a decent amount off of selling these shirts. So if someone has a posture issue, I totally recommend these shirts because they can wear them for long periods of time, you know, months at a time if they need to, and they don't need to keep getting taped. So people who have forward head posture, military neck, they're great for supporting the muscles. You know, and people who come in like this, you see the development over time. So we need to focus on getting them back into the upright position. And what those shirts do is they really help support them while they're in motion and getting the whole back support. Because you can tape a little area, but you don't want to tape someone, you know, butt to head. I mean, that just doesn't look good. And especially if they're older, they don't want to be taped up like that. Different inflammatory foods, I always like to cover some of this, some really cool ones. Avocado, you know, barley grass, basil is a great one. Bee pollen is one of the ones that we'll see coming up here. And so here's a question for you. What is the anti-inflammatory spice that MDs are giving diabetics that is potentially deadly? If you can type in the answer to this question, we'll have a special gift for you up at Brimhall Homecoming here. So, you know, that's pretty much what I'm going to be covering today. If you have any questions, please chime in here. If Clark has anything for me here. Clark?
Okay,
Clark?
let's see. I just unmuted here, so one of our doctors is just put in turmeric. Wasn't a question with it. Does that?
Yep. So that's the answer. Well, that's the answer to one of the questions. But no, it's. So here's the question again for you. It's what's the anti-inflammatory spice that MDs are giving diabetics that is potentially deadly to them? So we'll see if anyone can get it here. It's interesting because you see them doing it on a broad scale, and it's totally like they need to have their liver enzymes checked because they're getting it. And I'd say 70% of doctors out there are not checking the liver enzymes because they have no idea that it's deadly to the patient. Do we have any more answers there?
Doc, it looks like no. That's all I got.
All right. So the answer to the question is cinnamon. Cinnamon is a deadly spice, and it's absolutely toxic to people at mass doses, and they're giving it to them in mass doses to help their blood sugar levels, but they don't realize that it can absolutely destroy their liver. So anyways, I hope you guys enjoyed the call today, and Clark, I want to thank you for having me. I love your system, and I can't even imagine my practice without it, man. You just knocked it out of the park with it.
Thank you so much, Doc. Appreciate your time today, and we sure look forward to seeing you at homecoming.
Yeah, I'm excited about being there, and last time we had about 250 docs there, and you know, I look forward to teaching you guys and doing some hands-on experience like we did last time, some open labs and some free giveaways and stuff like that.
Great, great. Well, thank you, Doctor, so much for your time today. We wish you the best as you move forward, and again, look forward to seeing you at homecoming. Take care now.
All right, have a good day.